Understanding HPV. What you need to know. Did you know one woman is diagnosed with cervical cancer every 5 minutes in the world? And every 6 minutes, one woman loses her life due to cervical cancer. The incidence of cervical cancer is increasing year after year, and the occurrence age tends to be younger. Cervical cancer is terrifying, but it is also the only cancer that has a clear cause and can be completely eliminated through early prevention and treatment. In 1997, the German scientist Harald Zerhausen discovered that cervical cancer was caused by a kind of human papillomavirus, HPV. This discovery won a Nobel Physiology and Medical Award in 2008. In 1995, World Health Organization (WHO) announced that HPV was the primary cause of cervical cancer. So far, more than 200 types of HPV have been discovered, among which 80% to 90% are low-risk HPV. Most of the low-risk HPV will be cleared by our body's immune system within 1 year or two, but sometimes warts can be induced. What truly terrifies us are the high-risk HPVs, especially HPV-16 and HPV-18. They are the terrorists among the high risk. According to research statistics, about 70% of cervical cancers are related to these two types. They are extremely destructive. It would be quite dangerous if they have stayed on you for a long time. Hybrid BIOS tips. It takes 5 to 10 years for HPV infection to develop to cervical cancer. If one's immune system is normal, 91% of the HPV infections can be cleared by the immune system within 2 years. So infection with HPV does not necessarily mean cervical cancer. Only continuous infection with high-risk HPV may lead to cervical cancer. The ways HPV virus entering human body mainly are through sexual behavior and mother-to-child transmission. But it also hides in unclear sanitary ware and supplies, waiting to infect you. Infected women usually have no symptoms, but if you have symptoms such as abnormal vaginal discharge, painful urination, bleeding or pain during sexual intercourse, please do be cautious. You need to go to the medical institution for necessary examination as soon as possible and exclude the risk of cervical or vaginal cancer. Men should also take HPV seriously because it can infect a male as well. The condom cannot 100% isolate it. So if you don't pay attention, it may cause penile cancer and anal cancer. HPV infection is also closely related to laryngeal cancer, lung cancer, and esophageal cancer. Hybrid BIOS tips. Cervical cancer is the only cancer with clear etiology in the world. Basically, the early cure rate of cervical cancer can reach 100%. Therefore, early prevention, early detection, and early treatment can maximize the elimination of cervical cancer. In developed areas, cervical cancer incidence rate and mortality rate have been reduced by more than half through regular screening of cervical cancer. Cervical cancer screening has 3 steps. The first step is preliminary screening. The second is colposcopy inspection. And the third is histopathological examination. The most important step is preliminary screening. It is the first step to prevent cervical cancer. The conventional preliminary screening can prevent the potential risk of cervical cancer in the early stage. So, what are the methods for the preliminary screening of cervical cancer? Cervical cytology and HPV DNA testing. HPV DNA testing has advantages such as better sensitivity, objectivity, repeatability, higher negative predictive value, and capability to genotype HPV. With the improvement of molecular diagnosis technology, HPV DNA detection technology also develops rapidly. In addition to HPV genotyping, it can also be detected at RNA and protein levels, such as E6 or E7 RNA detection, E6 protein detection. In addition, with the improvement of research on gene methylation, Research on genes regulating the occurrence of cervical cancer has also been developed. For example, the study of genomic methylation sites can perform a triage diagnosis of HPV-infected populations to bring down the frequency of colposcopy. In 2015, the American Society of Colposcopy and Cervical Pathology, ASCCP, adopted HPV DNA testing as the primary method for cervical cancer screening programs. The Regulations for Diagnosis and Treatment of Cervical Cancer 2018 issued by China also clearly pointed out that HPV testing can be used as an effective supplement to TCT. The combination of the two helps to improve the efficiency of screening. Therefore, HPV DNA testing has an irreplaceable advantage in cervical cancer screening. It can help us predict the situation of infection, take reasonable preventive measures for treatment before the disease, and avoid future troubles. Attention! If the same high-risk type of HPV was detected twice, with a detection interval of more than 1 year, this is the so-called persistent high-risk infection. We should be cautious if it is HPV-16 or HPV-18. At this time, the risk of cancer is high. One should have a colposcopy in time and actively intervene. Hybrid Bio is committed to the promotion and application of HPV genotyping testing. Responding to the national call for the 2 cancer screening, Hybrid Bio actively participates in charity and carry out large-scale population cervical cancer screening activities in Guangdong, Shandong, Liaoning, Hunan, and Zhejiang. Meanwhile, echoing to the advocation of WHO's 2030 strategy of HPV elimination, Hybrid Bio involves in cervical cancer prevention and treatment programs in more than 20 countries, including Malaysia, Iran, Germany, Nigeria, Sri Lanka, and Australia, etc. The HPV kit has been certified by WHO LabNet for 100% proficiency for 4 consecutive years. The brand Hybrid Bio is highly relied upon by patients. For more than 15 years of development, Hybrid Bio has carried out HPV screening for more than 40 million women, established the well-known reputation of HPV genotyping test technology worldwide. In addition to HPV DNA testing method, HPV vaccination is another way to prevent cervical cancer. Currently, preventive HPV vaccines do not include all high-risk HPV types. Even if you are vaccinated with a 9-valent HPV vaccine, it can only resist up to 9 types of viruses. Please note that vaccination cannot completely prevent cervical cancer. Regular cervical cancer screening is more important and is the only way to early detect precancerous lesions and stay away from cervical cancer as much as possible. Hybrid Bio's tips. 1. Male can also be vaccinated with 419-valent vaccine. 2. If you miss the best time for vaccination, it is recommended to conduct cervical cancer screening regularly. 3. Even if you have finished HPV vaccination, regular screening is required to truly prevent cervical cancer.